We have an advantage that we have many options. In the US, for frontline therapy and growingly in many other countries, we have 5 drugs approved for frontline therapy. Imatinib, then 3 second-generation TKIs, dasatinib, nilotinib, and bosutinib, and then more recently, asymptomatic. And they all have different properties that make them valuable. And I think what's important to remember here is that we need to take advantage of every option that we have. It's not that we're going to select one to treat all our patients, but rather we take advantage of the benefits of each one, their pros and their cons. And then many aspects have to do with these. Very importantly, I think, what are the goals of the patient? If you're looking for trying to have the best probability of a deep molecular response, having a better chance of treatment-free remission, the newer drugs give us more of that. Asymptomatic, it seems to have the best chance of doing that. But there's also comorbidities and risk factors of the patient. So the patient, particularly those that have a high risk of arteriocclusive events, that already have history of heart attacks, or that they have a lot of risk features, diabetes, tobacco use, high cholesterol, hypertension, all these things, imatinib gives the lowest risk of arteriocclusive events of all the drugs, followed by perhaps bosutinib and asymptomatic. If the problem is other adverse events, these nagging low-grade toxicities that patients frequently experience, a little bit of diarrhea, a little bit of muscle cramps, a little bit of nausea, a little bit of all these things, asymptomatic seems to have the best safety profile. Now, sometimes, unfortunately, cost considerations are the primary issue because of the circumstances of the patient, lack of insurance or whatever that may be. Well, fortunately, imatinib is generic now, and the cost is very low. And again, it is a good drug, so that could be a consideration. So you have to put all of these together and, very importantly, have the discussions with the patient and talk about pros and cons of each one and what has the better chance of getting you where you want to be. I think it is also important to remember for the patients and the physicians that the important thing in CML is the long-term goals. In the short term, patients may look good or may feel good and so on, but we are looking at the long-term goals, which are years from now. You don't stop treatment in the patients who are eligible until they've been on therapy for a few years. So it is very important to keep an eye on the long term, but at the same time, it's also very important not to be very jumpy on immediate responses and minor changes, but rather, be patient and analyze data and trends rather than individual minor changes in the PCR or the test that you're doing. So very important to be aware of all the different possibilities and keep an eye on the long-term goals. Every drug has their own schedule of administration, and there are some drugs that are affected by administration with food. The most notable ones are nilotinib and asymptomatic, but for completely different reasons. With nilotinib, if you take it with food, particularly with fatty food, you increase the absorption of the drug, which has a disadvantage of potentially increasing the risk of having side effects. Of course, if you have more drug in your system, you may have a better response, but are you going to have more side effects by having more drug in your system than you're supposed to have? Asymptomatic has the opposite effect. Food decreases the absorption of the drug, so then you can decrease the efficacy of asymptomatic if you take it with food. So those two drugs are recommended to take on a fasting state. On the other end, you have dasatinib, which you can take with or without food, and it doesn't affect the absorption at all. And others like imatinib, where you could take it on an empty stomach, but patients tend to feel better if they take it with some food. You don't have to have a full meal, just a cracker or something like that, just something to kind of protect the stomach from the effect of the drug. So it is important to understand and to follow the recommendations, because it may have implications in your probability of response and the possibility of side effects and things like that.